and what are some of the signs and symptoms, and also what are the risk factor. I'll be taking you through those topics. And we'll just start. I hope my voice is okay. Normally when I'm doing this with because I work with the community, because it's diabetes talk, I'll prefer that we just interact, and I'm not going to do it like so much professional. I'm just going to make it talk with a simple language that everyone will understand. So namaanisha saa zingine nitakuwa naongea na Kiswahili, switching on and off in English so that all of us can understand. I think when we do it that way, people will get to understand even better. So starting diabetes mellitus, non-communicable diseases, also known as NCD, are the leading cause of death globally, and diabetes mellitus is the fourth main contributor. And that's why we need to understand more the effect, because it's top 4 leading cause of death globally. There are 3 main types which we'll discuss. Type 1 diabetes, it contributes at least 10% of the total. Then type 2 diabetes, it contributes to 85%. That means majority of people get type 2 diabetes, and we'll understand why. Then we have gestational diabetes, which is just 5%. It's not so much, but it is very, very important to understand about it. So affecting 347 million people, and there are about 1.3 million deaths in 2008, as this was a long time ago. And it is being predicted it will be over 2 million by 2030. So this is very, very important to know that it is increasing, so that we all take precautions on what we're supposed to do, okay? So defining diabetes, diabetes is a condition in which the body does not produce insulin, enough insulin, or completely no insulin production, okay? Leading to high level of blood sugar. This may come about due to insulin deficiency, okay? The body does not produce enough insulin. We'll also understand the function of insulin and how it relates, and the function it is playing to make sure that we have balance between the glucose in our body, because diabetes normally means that you have high blood glucose in our body, which damage our organs, and we are going to get that as we go along. So it's also finds that insulin resistant, okay? Insulin resistance is just a term that your body cannot produce insulin, okay? Because maybe you are overweight or you are obese, okay? Those are some of the factors that we are going to pass through to understand more. Also, diabetes is being caused by destruction of cells that produces insulin. For example, we have the beta cells that produce insulin. Sometimes they get distracted or destroyed, sorry, by maybe our immune system destroy them, or bacteria, and even sometimes virus infection can cause totally damage of these beta cells. We are going to talk more on that as well. So sugar is used in the body to give us energy. Insulin helps sugar get to the cell, to the parts of the body to give us energy. People who do not have the disease have a balance between sugar and insulin. So as you can see on the picture on your left, glucose and insulin. So when you don't have diabetes, your glucose and insulin should be equal, in equilibrium, okay? And when you develop diabetes, your insulin and glucose are not in balance, okay? So that means your glucose will be high, okay? Will be more in your blood. And maybe sometimes you have less insulin, or you don't completely produce insulin in your body. So glucose in our body help us give it, it gives us energy. And when you eat food, the function of insulin will push the glucose into our cells, okay? That we are going to use it to get energy. Sawa. So when you don't have enough insulin, ama kama hauna hii insulin ambayo ninaiongelea, what is going to happen is the glucose is going to stay in your blood, which is not supposed to. It's supposed to be pushed in your cell, so that when you are walking, you are doing your manual work, that energy is being used at that time. And I'll explain more on how, when you'll understand more when I talk about the signs and symptoms of diabetes, and I'll be able to explain to you physiology behind what you need to understand, why we need the glucose to be pushed in our cells. If you have any questions so far, please, you can go ahead and ask. I'll be glad to answer. So we have 3 types of diabetes. Type 1 diabetes, which is also known as juvenile diabetes or insulin-dependent diabetes. And this type of diabetes, the body does not produce insulin, okay, due maybe to destruction of the beta cells. And this, as I mentioned early, our immune system can attack the pancreas or destroy the pancreas, resulting to no insulin. There's no insulin that is going to be produced. Sometimes virus can cause destruction of the cells and bacterial infection, okay? Most of the people who are diabetic type 1, they inject themselves with insulin kwa sababu hakuna insulin yote mwili yao inaweza kuproduce. So inawaforce wajidunge insulin kwa mwili yao ili waweze so that the insulin yenye iweze kupush the excess glucose, as vile tuliona kwa the previous picture. So this type 1 diabetes is commonly among children and young adults, okay? So tuliona inachangia like 10% in the total population. So si watu wengi sana wanapatikana na hii ugonjwa ya type 1. Sasa I think we also talk about type 2 diabetes. Type 2 diabetes, the body does not produce enough insulin in this type of diabetes. Iko kiasi, but it is not enough. Now, mostly there's some underlying factor that contribute to type 2 diabetes. One being maybe family history of diabetes, and several others that we'll tackle as we go along, okay? So this may come about due to insulin deficiency or beta cell dysfunction. The body does not produce enough insulin. And then there's insulin resistant or tissue insensitivity. The body cells resist the normal function of insulin, which is to drive glucose into the blood, into the inside of the cell. As I told you earlier, the function of insulin. So the insulin is not functioning the way it's supposed to, okay? In type 2 diabetes mellitus, it's more prevalent among Hispanic Native American, African American, and Asian. Another thing that you need to understand, type 2 diabetes is less common in non-Western countries. And in sababu, we tend to spend a lot of, like we do a more work and so forth. But, and also our food, ain't a lot of calories, okay? But however, this is changing now because most of us have started adopting the Western lifestyle. Like ukijaribu kulinganisha na zile enzi za zamani za mababu zetu, they could walk a long distance, grandmother fetching water, long distance, they could even wanaendesha baiskeli. Lakini siku hizi so many people are just, everything imekuwa, wana minimize a lot of movement, okay? So people nowadays are just calling in for maybe KFC food iletwe kwa nyumba, hata gas siku hizi watu wanaletewa tu kwa nyumba. So there's so much thing that we are not doing. Even our food that we are eating. We are eating a lot of food with calories. Watu wanapenda kukula pizza, chips, vitu zenye maybe pale zamani hazikukuwa. So as much as we are saying diabetes is less common in non-Western countries, we should understand that it is really people are getting this because they have already, they are adopting the life of Western countries, okay? Another interesting type of diabetes is gestational diabetes. And before even I go there, in type 2 diabetes, treatment mostly you can, if you get diagnosed early, and the doctor might start you with maybe lifestyle modification, and then you start your medication, okay? And then as you go along, to those who have a very poor control of diabetes type 2, sometimes the doctor recommend them to inject themselves insulin so that they control, or they just bring the glucose down, okay? So the third type of diabetes is gestational diabetes. Diabetes that comes during pregnancy and goes away after delivery. So it is not common, but as I said earlier, we have started. We are actually adopting lifestyle, Western countries. So we encourage all the mothers who are pregnant to have tested, especially wakiwa around 26 to 34 weeks of pregnancy, so that they know their condition concerning diabetes, gestational diabetes, because it has, iko na madhara kwa mtoto na kwa mama. Kitu ya kwanza, mama ako na high chance ya kudevelop if she tends to have gestational diabetes, okay? The second thing, there's a possibility of stillbirth. Mtoto atazaliwa kabla ya wakati, okay? Another thing that a mother can maybe get, kuna kitu inaitwa preeclampsia, which is hypertension, ama elevated blood pressure akiwa mjamzito, which is very, very dangerous. Some of the mother, mtu akipata hii na maybe ako mjamzito, anaweza akaaga dunia. So that is very, very important to know, so that when mothers are pregnant, these are some of the tests that they can do just to know how their sugar are, to avoid those complications. On the other side, kwa mtoto, the child have very high chance of developing type 2 diabetes and also becoming obese baadaye, okay? Na pia huu mtoto anaweza akakufa kabla ya kuzaliwa ama baada ya kuzaliwa. So this is one of the things that I encourage women to go and have the test, because it has no signs. It's not like the other two type of diabetes, just the one that come during pregnancy. Na you can only know that sailo umeenda kupima, especially those with wenye maybe wako wazito. I encourage them to do, but it can get it. Gestational diabetes inaweza shika mama yoyote, okay, ambaye ako mjamzito. So ni muhimu sana kuweza kufanya nini? Kujipima ili uweze kujua hali yako. And I said unafaa ujipime ukiwa at between 24 weeks to 32 weeks, because there's a lot of hormonal imbalance at that level, because mtoto ameanza kukick, okay, and hizo hormonal imbalance ndio zina interfere na function of insulin, which make your glucose go up. Okay, any questions so far? We are all together?
I can see Vincent hand.
I have a question. You said type 1 diabetes is also called juvenile diabetes, or there's a third name you gave it, a synonym of the type 1 diabetes mellitus.
Insulin dependent.
Insulin dependent?
Yes.
Okay, thank you.
Yeah. Okay, thank you for that. It's actually just describe and just say insulin dependent because you have to inject yourself insulin. There's no other treatment for that. Okay. Thank you.
Welcome.
Okay, we go to the risk factor of getting diabetes. So risk number one is overweight or being obese. I'll try to define overweight or obese later in this slide so that we can know how do we know if somebody is overweight ama ako obese. Another thing is family history of GDM, I mean of diabetes. We say DM, meaning diabetes mellitus. So if you have a family history, your mother, your father who is diabetic, so already you are at risk factor of developing diabetes. And if you know that, you need to keep on checking your diet. You need to keep on checking your glucose. Okay, you avoid some of the risk factor that I'll talk you. You check your weight, okay, because already you are at risk factor. And when you are at risk factor, you don't want to add more risk factor that will trigger you developing diabetes. Okay. Now, at this level, most of the people, when wakiambiwa kuwa family history, they think diabetes is just for people who are at a certain age. When you have family history, it means you can get that diabetes type 2 any time of your life if you don't observe some of the risk factor. Okay. So another risk factor is hypertension. Hypertensive patients have high chance of developing diabetes because hypertension and diabetes go hand in hand, okay? And their risk factor are the same, okay? Obesity, they all affect our cardiovascular. So when you're hypertensive, the only thing you should do is to make sure that you're taking your medication on time, on the right, the way the doctor prescribed. And then you make sure that you're seeing your doctor as scheduled, so that you don't want to develop more complication that will lead you to getting diabetes. So it is always very, very important to make sure that you are exercising as well, so that you don't become obese, because that is one of the trigger that will cause you to get diabetes. So you make sure you are watching your diet, you are exercising, okay? Another risk factor is a lack of exercise. Those people who don't like exercising, they're just sitting down, resting, they're immobile, okay? Now exercising, actually you can do it in so many ways. You don't need like to go to the gym. You can just decide that if you're working on the 5th floor or 4th floor, at least you make sure you're using, you don't use lift, you just use stairs. And by doing that, you realize that you'll be breaking down your calories. Also, you can just decide to put music in your house. Now dance too, na dance. And that is an exercise. Kufanya kazi ya shamba kama uko na mali unafyeka. Those are some of the exercises. They are very simple, and you can do them as you're having fun. So that na itakusaidia ku reduce weight, because exercise inasaidia a lot of things. It actually helps inafanya cells kuwa more sensitive to produce the insulin and so forth. So iko na so much benefit in your body. So also another risk factor is eating food with a lot of fats. Of course, tunapenda chipo, tunapenda pizza na vitu kama hizo. So if you want to, especially kama uko na family history, these are some of the things that you really need to watch out. Na hata kama una diabetes, these are risk factors. So inamaanisha if you don't watch your diet, you eat food that iko na mafuta mingi, you become obese, you become overweight, you develop insulin resistant. The moment you develop insulin resistant, you become diabetic. And when you become diabetic, unajua this is a lifetime, it's a lifetime disease, yenye utaendelea kutumia madawa the rest of your life. So it's just good to avoid. We don't say that you don't eat kwa sababu tunazipenda, but just make sure you limit yourself on how the quantity you are taking. Okay? So that at least unakuwa at the safe side. So another risk factor is smoking. Okay? Ukismoke, uko na high chance ya kudevelop a lot of diseases, lungs disease, heart problem, and diabetes. Sasa, kwa sababu what the smoke will do, it narrow your veins. Okay? It narrow your veins. Na pia the same thing itafanya upate diabetes. So another thing that I had already said earlier was number 7 is giving birth to overweight babies. So any mother, kama ulijifungua mtoto wako, maybe the firstborn alikuwa na overweight and you're expecting to have a baby, please make sure the next time you go for your ANC clinic, hakikisha umepimwa sukari. Okay, so that at least when you get treated, wakipima waone uko na hiyo ugonjwa ya kisukari ya ujauzito, you will get treated and it will make you like utakuwa at more risk of developing diabetes in the future kwa sababu utapata matibabu. And then the doctor will tell you what you're supposed to do. Sometimes they recommend you exercise ukiwa mjamzito, but exercise at same you anza kukimbia. Okay, we don't encourage when you're pregnant to run ama tufanya heavy exercise. Just simple exercise, continue walking, doing your manual work and unafanya kwa nyumba. Don't be idle. Now this one actually goes to all mothers wenye wako wajawazito. When you're pregnant, please don't be idle, kuwa active. Walk, make sure you are doing some work. Okay, usikae tu because there's that you are already at risk sa ile uko pregnant of getting gestational diabetes. Okay, so risk factor ingine ni age. Those who are 45 and above wako at high risk of developing diabetes, but hii haimaanishi ati sasa kama uko below 45 years you cannot get diabetes. You can get diabetes if you don't observe those simple. Somebody saying? So I was saying, if you're below 45, you should not think that you cannot get diabetes. You can get diabetes if you don't observe your weight. Okay, if you don't exercise, you just live sedentary life, you are likely to develop diabetes, especially if you have a family history of diabetes. Okay, so we had talked about overweight and obese, and I promised you to just show you how we define overweight. So overweight, we define overweight when BMI is 25 and above kilogram per meter square. Okay. And also obesity is defined as BMI of 30 and above kilogram per meter square. So you can always check your BMI, because BMI is very, very important, because it will tell you where you are falling. Okay. So sikia umeongeza uzito kiasi, unaenda unapima BMI yako ujue. Na BMI inasaidia because huwa inakueleza how healthy you are. Okay? How healthy you are. So you work out to make sure that your BMI haijapita 25 na is not below 18, because now below 18 utakuwa uko underweight. So you just play it around there and inaeleza vile afya yako iko. Okay? Kuna hii niliweka hapa inaitwa high risk ethnic or racial groups. So nilikuwa nimesema about African American, but we did a study on gestational diabetes, I think 2 years ago. And we realized that there's a certain ethnic group in Kenya who have a very high prevalence of developing diabetes, either gestational diabetes or type 2 diabetes. I will not be able to, I can't say which ethnic group, because we are still doing the analysis, and when it's out, it will be published. But there's a certain ethnic group. So that means we need to observe on what we are eating, and we continue doing exercise. And ride a bicycle, that's a very good exercise that you can do as well. Say local, uko na free time. You just put it in your schedule. Hypertension, nilikuwa nimeongelea kuhusu hypertension. It's another risk factor. And niliweka hapa so that I can show you how we define somebody who is hypertensive. You are hypertensive when your blood pressure is something 140/90 and above. Okay. So ukiwa katika saile, maybe umeenda clinic, always check your blood pressure and make sure you know. Ukiwa above 140/90, you make sure that you know you are developing maybe hypertension, and hypertension is a risk factor for diabetes. Okay. Something to note, many patients with type 2 diabetes are asymptomatic, and their disease remains undiagnosed for many years. Okay. Ugonjwa wa kisukari kwa wengi wanaweza kaa nao kwa mwili kwa muda sana kama wajawahi sikia the symptoms. Okay. Now that's why we encourage people who have this risk factor to check their blood glucose so that they get diagnosed early. Because diagnosed early, it minimizes the organ damage and it's carrying a letter and all those other conditions that we are going to learn today. But by the time the symptoms zinajitokeza, already some of your organs zimeanza kuwa damaged. That's why those signs and symptoms zinaanza kuonekana. So type 2 diabetes, you can live with it for long without knowing. Where I work, we normally do screening, random screening. We had last year, August, we did something we call Community Dialogue Day. And we normally do diabetes screening and hypertension. So, and we screened over 300 people, and we found so many of them who had either diabetes or hypertension without knowing. Okay. And the good thing is now they know, and they can start maybe lifestyle modification. They can start exercising. By the time maybe the symptoms start showing, they have already started working on it. Okay. And they tend to live longer than those people who do not, who just wait until they get the symptoms. Okay, so we go to sign and symptoms. Any question?
Yes, question.
Yep.
Okay, it's Vincent.
Yes.
Well, there's a statement you have said, and I just had a thought about it. Because you see, you have said, okay, yesterday we had a session about hypertension, and they share a similarity with diabetes because most of the cases are symptomatic, and whenever they present, most people present when they are very severe. So what is the best way, you see, as, okay, what is the best way to prevent some of these things? Because there are people who don't know, and you see, okay, it's something that, according to the statistics you've posted, it's something that is increasing gradually. So
yes.
I'm just thinking, maybe you see prevention is better than cure, and what is the best way to go about it? Because, well, I wouldn't, okay, I'm just trying to picture the scenario according to the statistics, and
so
you see, something that,
yeah, go on.
Yeah, that was just my question. I'm done.
So just let me just get your question clear. You are saying that how can we prevent this type of diabetes or hypertension that are asymptomatic?
No, I'm asking, this is my question. Let me be clearer. So diabetes, you've said most cases are asymptomatic, so they don't present with symptoms.
That is type 2, yeah.
Hello?
Yes, I can hear you, type 2 diabetes.
Yes, and also for hypertension, most of the cases are asymptomatic. So which is the best way to prevent such diseases, then the non-communicable diseases?
Okay, thank you. Thank you so much for that. Yeah, that's a very good question. So I've already talked about risk factor, okay? And the only way to prevent this type of disease, first of all, is if you're smoking, you quit smoking because those are risk factor, okay? You need to be active. You start exercising, okay? You do a lot of exercise. And if you also need to know if you have a family history of diabetes or hypertension, because they go hand in hand. The moment you realize that, for example, if I just know that I have a family history of diabetes, what I will do, I'll start avoiding all the risk factor. I start watching on my diet. For example, I encourage people to eat a lot of vegetable and fruits. Hata kama unahitaji carbohydrates, you just eat it in portion, kidogo, but with a lot of vegetables. So you start watching your diet as early as now, after you realize you have those risk factor. Okay? That is the only way you can prevent. Another way you can do that, after you just realize that, you keep on checking either your BP or your diabetes, I mean your blood glucose. You keep on checking every time you go. You can give yourself like every month, I'll be checking my glucose, just to know, because the moment you just realize early, you'll you'll be in a better position than somebody who waits until the symptoms come. So for hypertension, unfortunately, it is called silent killer. Okay, so most of the people do not know if they have, because it does not present until maybe at the last stage where already ikianza present, it's now worse. So the best thing with also hypertension is just to do the same. Avoid a lot of salt. Make sure you check your BP. These are just simple tests that you can do. You can go to the hospital. Even on the hata kwa chemists, they have this BP machine. You just check, because when you have hypertension like gonge, you get a stroke and you just die. Unasikia mtu amekufa na heart attack, saa zingine hata ni pressure or something of the sort. So these are just simple things that you just need to avoid risk factor, and then you live healthy. I think I've been able to answer your question.
Yes, you have. Thank you.
So signs and symptoms of diabetes. This, as I said, type 2 diabetes is asymptomatic. It also have symptoms, okay? Now we have three, I call them 3P, which is normally present silent to diabetes. This is polydipsia, polyphagia, and polyuria. Those are three. I'll explain it so that you can. So polydipsia is excessive. When you have diabetes, it means you have a lot of glucose in your body, in your blood, okay? And your insulin cannot be able to push the glucose to the cells. So what will happen, your kidneys will try to remove excess glucose in your body, okay, as urine. And that way, so the water will come out of the cell to try to get rid of this glucose as urine. Okay, so you are losing a lot of water because you need to remove excess glucose in your body because haitakikani, body na complain nasema hapana, we need to remove this excess glucose. So in that way you are losing water, you feel, so the body ina communicate inasema kuwa unahitaji maji kwa mwili yako. So you start drinking. You drink, una pass. You drink water, unatoa glucose. Sasa, so that's how, if you realize you are now getting so much dust, like every time unakunywa maji excess na utosheki, that's a sign of diabetes. Another thing is, another symptoms is polyphagia, excessive eating. So when you have you are developing diabetes, you tend to eat excessively because the glucose that iko kwa mwili haikui pushed into the cell to give you energy, okay? So you don't have energy. Huwezi tembea, you don't have energy. So the body thinks that hauna chakula kwa mwili, okay? So ina increase appetite. So you start eating because the body thinks huyu mtu ni chakula anahitaji. So you start eating a lot of food, but in real sense, it is not that unahitaji chakula. It's only that your insulin is not working efficiently. Sawa. Another sign and symptoms is tiredness. Unasikia kuchoka, and this is because I've already explained, you don't have energy because sukari yako haiendi kwa muscles, sasa kwa cell, so that itumike kama energy. That's why you get so tired. So the third P is polyuria. Polyuria inamaanisha kukojoa. Sasa, so frequent urination. And this one I had explained when I was talking about that glucose in your body. Your kidneys is trying to eliminate excess glucose in your body, okay? So you always go to unaenda kwa choo saa yote kukojoa. Na especially usiku sana, unaweza enda karibu mara 7 usiku. So ukianza kuona you are doing that, please you need to seek for further checkup, just so that you can know if you have diabetes or not. Another sign and symptoms, mostly unexplained weight loss. So this comes again because I already explained to you the glucose in your body is not being used, is not being pushed to your cell to give us energy, okay? So our body will try to look for other means of ili ukue na energy. Sasa, this process called gluconeogenesis. Inamaanisha itatumia other means, and this means itaanza kubreak fats, ina metabolize fats ili produce energy, because mwili yako inahitaji energy. You need to move, you need to do a lot of things, okay? So, and you cannot do them without energy. So your body imekuwa stressed up kabisa, so inabidi break the fats na pia proteins, so that you get energy. And that's why you realize unakonda haraka sana kwa sababu that is not a normal way of getting energy. We are supposed to get our energy through the food we eat. Tukikula chakula kama carbohydrates, then inakuwa converted into glucose, the insulin push it to the muscles, and that energy inatumika kufanya our normal activity. So another sign is blood vision. When you have high glucose in your body, inaenda mpaka kwa macho. So ikifika kwa macho, your lens ina swell, okay? The lens swells and you cannot be able to see clearly. So when you start observing such kind of thing, please, you need to go for further tests so that the doctor can see if you have diabetes or not. Okay, any question on that?
Question, please.
Yes.
Could you please explain how okay, there's some irony because there's excessive dust and there's excessive urination.
Yes.
Could you please explain that?
Yes, so as I told you earlier, so our glucose, so this person is diabetic. Eh? The function of insulin is to push the glucose into our cells, okay? But the insulin is not doing that work. So inamaanisha a lot of glucose iko kwa damu, okay? There's an excess glucose in your blood. So what we'll do, that work inakuwa shifted to kidneys, okay? Your kidneys will work hard to eliminate excess glucose, okay? Na iwezi toka kama glucose, sawa? Haiwezi toka kama glucose, lazima itoke kama urine. And that way, this glucose will attract water from the cells. Sawa? Will attract water from the cells so that it can eliminate excess glucose. And by doing that, automatically, if you're losing a lot of water in your body, unaishikwa na kiu. Okay? Unashikwa na kiu. The moment unashikwa na kiu, itabidi ukunywe maji. So you drink a lot of water because you are losing a lot of water as a lot of glucose as a form of urine. So hapa kwa urine now, it's just the way I have said. You have a lot of glucose in your blood that need to be eliminated. Okay, so your kidney will try to work so hard to make sure that all the excess glucose is being eliminated. Okay, being eliminated, and that's why you keep on going to the toilet to urinate. Sijui kama umeipata.
Nimeelewa.
Umeelewa?
Yeah, that's better.
Asante.
Yeah.
So any other question? Okay, let's proceed. So we'll go, the next slide is screening and diagnosis. So first, when you go to the hospital and you want to be tested, or maybe you have some of the symptoms we have seen, so the doctor will ask you for few tests, okay? Hawezi fanya tu test moja alafu conclude that you have diabetes. So what the doctor will do, will ask you to come in fasting. So na fasting inakuwa defined as no caloric intake for at least 8 hours. So atakwambia ukuje kama hujakula chakula at least for 8 hours. Sababu ni kuwa we want to see how is your blood sugar sa ile una food. Sawa. So uta come in and he will use maybe a glucometer kama yenye nimeonyesha on my right. That's a glucometer. It's very, very simple. It's like 20 seconds. Some will do the venous. Watatoa damu kwa vein, alafu wataweka kwa lab just to see your fasting blood sugar. So if your fast blood sugar iko maybe around 126 milligram per deciliter, that is 7.0 millimole per liter or higher, you are likely diabetic. But as I said, we do not rely on one test. So there's another, so the next test that the doctor will ask you to do is something we call OGTT, oral glucose tolerant test, okay? So what happened in this test, the doctor will give you glucose, 75 grams, diluted to 200 ml, okay? You drink it. Ukisha kunywa, unagoja for 2 hours. We want to see how is your insulin responding to the glucose after 2 hours. Then the doctor will repeat the test. Okay, we'll repeat the same test that he did on the fasting, but only that this one is not fasting. It is an oral glucose tolerant test. And if your glucose level comes to 200 milligram per deciliter, or simply 11.1 millimole per liter or higher, you are likely developing diabetes. Then it'll also ask you to come in for random blood sugar. Random blood sugar is that you just eat normal food vile unakulanga, and then you come in maybe after an hour. Anakuja anakupima. Atatumia to the same glucometer or venous blood test. So if it inakuwa above maybe 11.1 millimole per liter or higher, you are likely developing diabetes. Okay? Na pia uko na these signs zenye tumeongelea kama polyuria, polydipsia, polyphagia, na pia maybe ume lose a lot of weight automatically, you're developing diabetes. Okay? So kuna another last test zenye daktari atafanya inaitwa HbA1c, hemoglobin A1c. Na hii inajaribu kupima kiwango ya your glucose for the last 3 months. Okay? So our red blood cells, when you have high glucose, some of the glucose inajiattach kwa hiyo hemoglobin. Okay? Now, whenever you do the test and it appear to be 6.5% ama high, you are also likely developing diabetes. It should be below. So another thing that you need to know is that the doctor sometime will ask you to do urinalysis to look for something we call glucosuria. So hiyo inamaanisha glucose in the urine. Hii ni suggestive. It is not a confirmation that uko na diabetes, lakini sometime anaweza anza na this one just to make sure before maybe you proceed to the rest of the test. Anafanya tu, anakuambia uende ufanye urinalysis. Na in case kutakuwa na glucose kwa urine, automatically utafanya the rest of the test alafu ataconfirm. So those are some of the diagnostic procedures zinafanywa. So we also want to talk about prediabetes. This is very important just to know what is prediabetes. Ama kuna anybody yako na swali, please?
Question, please.
Yes, please.
Please repeat on the oral glucose tolerance test.
Okay, OGTT.
Yes, kindly.
Yeah. So I said this is also one of the tests that is inafanywa ili conclude kama uko na diabetes. Sawa. Na either diabetes type 2 ama pia inatumika kuona kama uko na gestational diabetes. So what the doctor will do, will ask you to go, okay? Atakuuliza ukuje maybe kwa lab, and then he's going to give you glucose, 75 grams glucose. Sasa glucose vile tunaijua glucose ile ya kulamba. Sasa atakupea. Akisha kupea, lakini atakupatia ulambe, atai-dilute kwa 200 ml. So you take it. After you take it, you'll wait for 2 hours. At least 2 hours, alafu atafanya test. So the reason of doing this glucose tolerant test, we want to see how is your insulin functioning when it comes to this test umepatiwa glucose. Sawa? So akisha kupima ikikuja 11.1 millimole per liter or 200 milligram per deciliter, you are likely developing diabetes. So that is how it is done.
Yeah, it is clear. Thank you.
Okay, thank you so much. So we go to prediabetes. These are states in which blood glucose level are higher than normal, but not high enough to be diagnosed as diabetes. So simply, unapatanga umeenda umefanyiwa test na your results go inakuwa the borderline. Okay? Borderline inamaanisha, for example, kama fasting blood sugar ni 7. Okay? Sema ni 7.0. So na tumefanya test, tumepata imekuwa kitu kama 6, 6.9 ama imekuwa maybe 7.2. Yani you are just there. Uyuko low sana na uyuko, yani iko kwa borderline. So inamaanisha you are pre-diabetic. And you need to maybe take those measures, maybe uanze ku-exercise, ku-change your diet, lifestyle na vitu kama hizo. Sasa, but the same thing utarealize the doctor atafanya almost the same test za zenye tumefanya, zenye zitafanywa on diagnostic screening kama yenye nimetoka kusema. Is only that maybe the value za kudetermine if you are pre-diabetes zinakuwa ziko tofauti, but in slightly. It can be either slightly low or slightly high. So inaonyesha uko pre-diabetic. Now, when you are told you are pre-diabetic, the chances of you developing diabetes is very, very high, especially if you don't change. Majority of people, when they are pre-diabetic, they automatically develop diabetes. That is if they don't wasipo change their lifestyle. Okay? Badilisha diet, exercise. If somebody was smoking, quit smoking, and all those factors that tulisema. Sawa. And also unaona kuna hemoglobin A1C hapo chini yenye bado itafanywa. Tulisema hemoglobin A1C normal isikuwa above, it's either 5.6.5 and above. Sasa unaona kwa hii is only 5.7 to at least 6.7. So iko kwa borderline. Okay. Now on my right, you can see I brought something in for diabetes, pre-diabetes risk factor, which is almost just the same. Sedentary life, overweight. We have age, family history of diabetes, and low HDL. Okay. Any question on that? Okay. So as I conclude, I just wanted to share these benefits of exercise on effect of diabetes and on effect of diabetes. You tend to reduce visceral obesity, improve insulin sensitivity, improve glucose utilization. It also decreases decreases glucose production from the insulin, decrease the insulin level in circulation during exercise, help achieve good control of blood sugar level with low dose of oral anti-diabetic drugs and insulin. So inamaanisha when you do your exercise, maybe you're diabetic and you do your exercise, uta realize that utaenda kama ulikuwa unatumia tuseme 500 mg metformin, you are likely maybe to drop it slowly, maybe unaweza patiwa to 50, inategemea because exercise inasaidia kulower the dose, hata insulin as well. But one thing I also want to emphasize ni kuwa when you are diabetic, as much as we are emphasizing that tufanye mazoezi, you need to control it. Okay, you need to control it because when you overdo it, you'll get something we call hypoglycemia, which is very, very dangerous. And you can, I think this, the next speaker will talk more about that. It's very, very dangerous. And it's something that urgently needs to be attended to. So when you're doing your exercise, make sure you eat well and limit yourself. Don't overdo it. Unafanya tu ile ku avoid that Hypoglycemia inamaanisha sukari yako itaenda chini. Na ikienda chini, kuna a lot of consequences that comes in when your glucose goes way down. Okay, you can even go to coma. Sasa, so kwa cardiovascular, the exercise reduces total cholesterol, HDL, and cholesterol and LDL, and increases HDL. So LDL nasimanga ni bad cholesterol, and HDL is good cholesterol. Reduce blood pressure level, improve cardiovascular function, increase arrhythmic threshold, finally improved cardiovascular health, and reduce the incidence of coronary artery disease. So thank you so much. And in case there's any question, I'm ready to be more than happy to answer as we go to the next speaker. Okay.
Hi, hello.
Hi.
Hi, my name is Marion, and I'm a medical student at the University of Nairobi. I had a question.
Mm-hmm.
Is there a possibility of reversing diabetes? And second question is on, even as you've mentioned in pre-diabetics, a risk of, as in family history of diabetes. To what percentage would there being a history of diabetes in your family predispose someone to getting diabetes? And if the person decides to change their lifestyle, does it still affect them by the very virtue that diabetes still lies in their family?
So just to answer your last question, so let me just understand it well. You are just asking if I have a family history of diabetes and I'm trying to avoid all the risk factor. Am I still going to get diabetes? That's the question.
Yeah.
So yeah, what is going to happen? I cannot tell you that you will not get diabetes, but it postpones the chances of you getting diabetes. You might get diabetes in the later age, okay? But because you have a family history, especially if it's a close relative, the chances of you getting diabetes is very, very high. But by just avoiding the risk factor, you are in a good position to try and push it maybe on the later age. And also you might not as well get it, just depends. Okay. So what, I did not get the first question. Can you please repeat again?
The first question was on, is there a possibility of reversal for people with diabetes?
Okay. Unfortunately, no. Okay. Especially if you have type 2 diabetes and you start your medication, you will use your medicine for long term. The only thing that will happen is maybe the dose will keep on changing depending on the response of your body. Okay. Sometime, for example, if you had 3 types of drugs and your diabetes or your glucose is well controlled, the doctor will put you maybe on a monotherapy. Okay. And sometime when you do so well, the doctor tells you to do lifestyle modification. Okay.
Mm-hmm.
But most of the time you start with life modification before you get to the medication. So if you do well on life modification, you can actually stay that with life modification. But the moment it reaches a point that maybe your glucose are not good, the doctor will put you on a low dose of medicine as you continue.
So what you're saying is, even if there was an earlier diagnosis of diabetes even earlier on, there is no possibility even with lifestyle change and dietary modifications, there's no possibility of reversing the diabetes before it progresses.
So there's no reverse. The only thing it will do when you get diagnosed early, because we know diabetes has so many effects on your heart, on your kidneys, eyes, and so forth. So it will reduce the damage of those organs, okay? So you can live normal life. You can live normal life because now your glucose is under control, okay? Your glucose is under control. The fact remains you're still diabetic, but your glucose is under control, okay? So that is the advantage of you getting diagnosed early. Because when you get diagnosed early, you prevent the damage that the glucose will bring in your body.
Yeah.
Okay?
Yeah.
Yes.
So thank you.
Welcome. So I'll let the second speaker go on from there. Thank you so much.
Okay, thank you, Benson, for the session. I want to welcome the next speaker, Caren, to take us through obesity and its relationship to diabetic type 2 and cost implication of diabetes. Finally, Caren, welcome and take us through. Caren?
Yes.
There?
Yes, I'm there.
Welcome.
Hello.
Hi, too.
Can you hear me? Hello, everyone. Okay, I'll take you through the complications of diabetes, the control and management of diabetes, the relationship between diabetes and obesity. Yeah, that's all. That's what I'll take you through. And I'll not be using a PowerPoint presentation. I'll just do a talk. In the complications of diabetes, we have the short-term complications and the long-term complications. I will start with the short-term complications, and first we have hypoglycemia. Hypoglycemia is a term that is used to mean the low blood sugars. The hypoglycemia is usually common in patients who are using insulin or the sulfonylurea drugs. These are drugs that makes the body to produce insulin throughout the day. Other causes of hypoglycemia includes aspirin and also alcohol intake. In this way, alcohol usually keeps the liver from producing glucose. How does a patient realize that he or she has hypoglycemia? And these are the signs and symptoms. We have the rapid heart rate, sweating, there is whiteness of the skin, anxiety, numbness of the fingers and toes, sleepiness, confusion, headache, and also slurred speech. And hypoglycemia is manageable. And this is whereby the patient is required to increase the levels of glucose in the body. And in mild cases, a patient can take or drink orange juice or eat a glucose tablet. These are products that can increase the glucose level in the blood very fast. And if a patient is using insulin, he or she is advised to be carrying a glucagon tablet or an injection that can take or inject herself or himself with, as it will initiate a process that raises the blood glucose in the blood glucose levels. That one is a management of the hypoglycemia, as it is one of the short-term complications. Another complication is the non-ketotic syndrome, which is usually known as the hyposmaller hyperglycemic non-ketotic syndrome. And this syndrome is usually very rare. However, it is good for a patient to know how to handle this situation. And the syndrome usually occurs when the patient is very sick. It usually begins when the blood glucose is very high and the body is trying to get rid of the excess glucose through excess urination. I think the first speaker has already told us about this, that it is known as polyuria. And in this situation, the body becomes dehydrated and the patient becomes thirsty. When the patient is sick, he or she cannot rehydrate the body very well, and the blood glucose will tend to go very high up to a point of leading to coma. This one can be managed by keeping the blood glucose levels at almost the normal levels when the patient is very sick, in order to prevent it leading to coma. Those are the short-term complications of the diabetes. Then we have long-term complications. Long-term complications usually develop over time, and they can be controlled and avoided by changing the lifestyle. The lifestyle can be changed by adapting the healthy eating plan, doing exercises, and also being compliant to medication. And high blood glucose over time usually damages the tiny blood vessels and also the large blood vessels. When the tiny blood vessels are damaged, it is usually known as the microvascular complications. And when large blood vessels are damaged, it is the macrovascular complications. In the microvascular complications, we have the eye damage, the kidney damage, and also the nerve damage. With the eye damage, it usually causes the cataracts and retinopathy. The both effects causes the loss of vision. The diabetic retinopathy can be controlled by keeping the blood glucose within range, almost to the normal levels, and also having the eye examination annually. For the kidney damage, it is usually known as the diabetic neuropathy, and it can be controlled by having an annual test of microalbuminuria. This is used to check the levels of the proteins in urine. And usually it is an early sign that shows that the diabetic patient has a kidney problem. Then we have the nerve damage, which is usually known as the diabetic neuropathy. And it is in various forms, that is peripheral, autonomic, proximal, or focal. The diabetic neuropathy is usually very common, and it usually affects the hands and the feet. Usually the patient will complain of pain in the feet, the weakness or tingling in their feet. Those are the microvascular complications, and all can be controlled by managing the lifestyle and also controlling the blood glucose levels in the body. Then for the macrovascular complications, we have, it usually affects the heart, the brain, and also the blood vessels. In these large blood vessels, a plaque is usually built up that can cause a heart attack, a stroke, or vessel blockage in the legs. Prevention of these macrovascular complications can be controlling the blood pressure, controlling the cholesterol levels, not smoking, and also checking the cholesterol levels annually, which is usually very important. Controlling the blood glucose levels is usually the key part in this. In control and management of diabetes. The first speaker has already told us that diabetes has no cure, and it is true, it has no cure. The goal in the management and treatment in diabetes is to keep the blood glucose near to normal, maintaining the cholesterol level in blood, controlling the blood pressure to be not over the 140 or 190 millimeter mercury levels. And management is usually through having a balanced meal plan. And for a diabetic patient, they usually advise to take more of vitamins, that is vegetables and fruits in their diet, and little of carbohydrates and proteins. Too much proteins are usually associated with the damage of the kidneys. Another management is by exercising regularly. The first speaker also said that regular exercises help to control the blood glucose levels in the body. Also, compliance to medication. At no point should a diabetic patient say that they are already healed and can stop the medication. They should also monitor their blood pressures and the blood sugars at home, and keeping their appointments with their doctor. They should always go for regular checkups in the clinic. A diabetic patient can get support and information from the following groups, like family and friends. The Patient is usually very close to the family and they can be very informative about their condition and how it can be managed. Also, the doctor and the healthcare team, they should utilize the times they go to their clinics and ask the doctor questions that they are doubting about diabetes and about management. And that's where they will get answers. Also, joining the support groups that can be in two forms. There's a professional group that includes a medical professional, a nutritionist, and those are the professionals who can help these patients to adapt into living with diabetes and controlling their disease. We also have the self-help groups. These are usually formed by the diabetic patients who form a group to share their experiences, their successes, and that's how someone can get some tips on how to control their disease. Also, we have the online communities whereby the patient can join an online group where they'll be sharing the tips with their fellows on how they can live with the disease. Up to that point, anybody with a question?
Yes, I have a question. Karen?
Yes.
I have a question.
Mm-hmm.
Can you hear me?
Yes, I can hear you.
So please talk about the Non-Ketotic Syndrome. There's something I have not gotten about it. Kindly.
Okay, I said the Non-Ketotic Syndrome, it is a very rare condition. Yes, and it happens when the patient is very sick, whereby when the blood glucose goes very high, the body is trying to eliminate the excess glucose through urination. And at this point, the patient becomes dehydrated and he or she cannot rehydrate the body very well.
There is also, okay, yes, the question is answered. There's another name you have, pardon? There's another name you have given the syndrome. Hello? Hello, can you hear me? What other names do you call Non-Ketotic Syndrome? There's that.
Hyposmaller Hypoglycemic Non-Ketotic Syndrome.
Okay, could you just type it? Please type it in the.
Okay, I'll type it in the chat box.
Yeah, kindly.
Yeah. Any other question? Is there any question?
Hello, Karen. Hello.
Yes, I can hear you.
My name is Njoroge. My name is Njoroge. And I have a question. You say
Hello. I can't hear you, please.
I was asking about hypoglycemia. Is it when the sugars are very low?
Hello.
Karen, kindly let him work on the background first, then you will get back to us. You can continue.
Okay. You can send your questions into the chat box because I can't hear I think it is the unmuted one. I can continue.
Yeah, continue, then you check on the chat box. People are asking questions. You can answer them when you're winding up your session.
Okay. The next thing I'm talking about is the relationship between the type 2 diabetes and obesity. Actually, we know that having obesity is a greater risk of developing the type 2 diabetes, especially if one has excess weight around the tummy. That one is usually known as the central abdominal obesity. And from research, the 80 to 85% type 2 diabetes is usually to the obesity. And basically, obesity is having a BMI of more than or equal to 30. The reason as to why obesity is linked to type 2 diabetes is because of the inflammatory response that develops having the abdominal fat, and also the disruption of the fat metabolism in the body due to obesity. Now, in the inflammatory response, according to research, the abdominal fat causes the fat cells to release a pre-inflammatory chemicals which make the body less sensitive to insulin that it produces, and hence disrupting the function of the insulin responsive cells and their ability to respond to insulin. This is what we call the insulin resistance. Once the pre-inflammatory chemicals are released, the patient or the body is more likely to resist to insulin that the body produces. And in this case, the blood glucose tends to rise above the normal, thus resulting to diabetes. And in disruption of the fat metabolism, obesity usually changes the body's metabolism rate, and it causes the adipose tissue or the fat tissue in the body to release fat molecules into blood. The fat molecules in the blood affects the insulin responsive cells and lead to insulin resistance. What I mean is that once the fat molecules are released by the fat tissue into the body, the blood or the cells in the body become affected, and they become less sensitive to insulin. Once they are less sensitive to insulin, the blood glucose tends to rise in the blood. Obesity is preventable, hence we can avoid the type 2 diabetes by eating healthy and also doing exercises. Any question?
Hi, Karen.
Hi.
My name is David Njoroge. I was asking about the hypoglycemia. When you say if the sugars are low, you should add the insulin. When is it when you add it, the sugars may drop even more? It will tend to raise the sugars.
When you add what?
The insulin level that, as you said, if the blood sugars are low, to boost the sugars.
If the blood sugars are very low, you are not going to use insulin. But you have to raise the blood glucose level to normal by either using the glucagon tablet or taking orange juice, as I said.
Okay.
Because using more insulin will drop the blood sugars more, and it can lead to coma.
Okay, thank you.
Any other question?
Hello.
Yes.
You've mentioned about tummy fat.
Yeah.
Does that mean that women who have fat in the tummy, and it happens to, and actually even men, does that mean they are predisposed to getting diabetes? I didn't understand the relationship between tummy fat and diabetes.
Yes, they are predisposed to developing type 2 diabetes.
So,
hello.
Okay. I just wanted also to this is Benson, just wanted to answer the question maybe in a more clear way on hypoglycemia. So normally when you have a low glucose in your blood, it is not advisable for you to inject yourself insulin. And this is something that most of the people, maybe if they don't know the importance of insulin and or what insulin does in your body, most of the people will think that that is a solution, especially when you are hypoglycemic, you faint, you get confused, and this is now important because all of us can just realize that just reversing that hypoglycemia is very, very easy. You just need to get a soft drink, okay, like a Fanta orange, and you just drink. We also advise patients who are diabetes to work with sweets, okay? Because sometimes when you start seeing yourself dizzy, it's because you have not eaten, okay? You have not eaten, and your blood glucose is low. When it just like that, don't inject yourself insulin. Make sure you take those sweets, you gain energy and you eat, okay? But this does not tell you that you should not inject your insulin as normal. After you have done that, you have eaten, you continue with your normal dose. And it is very important for you to keep on checking your glucose level using your glucometer so that you know when your glucose is falling. So there are 3 signs of hypoglycemia, especially sweating, you get confused, you're out of word, and fainting. Those are just simple things that you just need to know that you're getting hypoglycemia, and it's very, very dangerous, okay? So just wanted to emphasize on that.
Benson, I have a question on the same. What you've just mentioned.
Yes.
Does that mean that any other person who goes through those symptoms has diabetes? If you get confused, if you're out of words, if you're shaking, if you're, or you're, I don't know, because a lot of people can get those symptoms if they have not eaten.
Yes,
So
I'm talking about, okay. I'm just talking to people who are diabetic, okay?
Okay.
When you're not diabetic, okay, of course, when you don't eat, when you're hungry, for example, if you drink alcohol and you have not eaten, so most of the time you'll find yourself weak, sweating. But for somebody who's diabetic, have not eaten and he goes to hypoglycemia, it is very, very dangerous because this patient can actually go to coma, okay? And even the chances of dying is very, very high because the body does not have glucose. So what you only need, simply take and you regain your energy. Or if you have glucose, you just unalamba to glucose, you regain your energy. And then after that, you eat. One thing that I want also to emphasize is that if you ever find somebody with that symptom, now maybe I'm a faint, please don't give them soft drink directly because we move to a unconscious. So what you need to do, you take sugar ama glucose una dilute, alafu unamwekea kwa ufizi, okay? Kwa ufizi. So automatically the glucose is going to be absorbed na ata gain energy. Akisha to gain energy, what you need to do, you can give this person, akisha amuka, you can give this person some kitu kama maziwa, now maybe a queen cake. Then from there, we check the blood sugar again, okay? Na akule, then after that, anakula normal. For you to avoid hypoglycemia event, you need to eat food, but you don't need to eat so much food. You need to eat, to keep on like eating around 6 times, small food, so that your body isikose any glucose in your body. So that means when you're diabetes, you're likely to get a low glucose and you tend to get high blood sugar. Both of them have effect. But the emergency one, when your glucose is too low, you take it as emergency. Sasa, because it's very, very serious. I hope I've been able to put it clear.
Yes, thank you.
Hey, Karen, kindly finish up as we welcome the next speaker. Karen, are you still there?
Yes, I'm there.
Okay, wind up as we bring to stage the last speaker.
May I interrupt, please?
Okay,
Yes.
go on.
Hello.
Hello.
Just there's something Benson has mentioned of. If you find someone who's unconscious somehow, and he has talked about some diluted glucose, the cocoa fizz around the gum. So what about if one tried an anastomosis tube with glucose solution to administer some glucose solution through an NG tube? Will that be feasible for the patient?
Sorry, sijasikia swali yako vizuri.
Nauliza. Pardon?
Ulikuwa na katakata.
Okay, so unaweza nisikia?
Yes.
Mtu anaweza tumia NG tube ku-administer glucose solution kumtoa unconscious.
Kutumia?
NG tube, nasogastric tube.
So this is something that will happen unexpectedly, okay? So what you need to do is just to use what you have to make sure that this patient gain conscious. Sasa, because inaweza kupatia kwa gari, inaweza kupatia kwa supermarket. So, but the simple thing is just understand that this patient anahitaji glucose. Na kama amefaint, you don't give it directly. Because inaweza mchoke because hayuko sawa mpaka at least aamke. Okay?
I think that's better. Thank you.
Okay. Thank you so much for having such an interactive session. And we have learned how to manage hypoglycemia, how to prevent complications, and all we can do is having a healthy living, eating healthy, doing appropriate exercises in order to control the blood sugar level. And thank you so much. I can welcome the third speaker.
Okay, thank you, Karen, for the lovely talk. People have learned a lot. For those who still have questions, maybe they can chat in the box so that she can handle them privately. Okay, the next speaker is David Njoroge. He will just be brief about diabetics. He will just share a little bit about diabetics. So I don't know what exactly, but he will just share just brief as we wind up. Kindly, David Njoroge, welcome. Kindly, we can't hear you. Kindly, can you use without the earphones? I don't know if it's the earphones or it's what, so that we can hear what you're saying.
Kindly, we cannot hear.
Is it possible for David to speak directly to the computer he's using instead of using the microphone?
Kindly, David, we can't hear what you're saying. Disconnect the earphones and speak. Yeah.
If you're trying to speak, maybe you're on mute.
What's happening, David?
David, we are not able to hear you, please.
David, we cannot hear you, so I guess I don't know how we can help you.
Can you hear me?
Yeah, we can. Can you increase the volume?
Okay, my name's Njoroge, and I'm type 1 diabetes. I was diagnosed in 2015 April when I started getting diabetes symptoms. Started taking a lot of water, feeling hungry, and also
Speak louder because your background is so noisy. Be louder.
can you hear me now?
Yeah, we can hear you. So speak louder so that we can understand the background noise.
I'm doing the
I think I can't hear. Kindly disconnect the microphone. And then just be stable, don't move.
Hi guys. My name is Benson Kiragu. There are two Benson Kiragu here. If David would call somebody would put him on loudspeaker so that we can use our speakers to project to others. So I don't know whether anybody knows David and has his phone number. So that he can speak on the phone instead of the microphone he's using.
Yeah, I think that's a good idea.
David is now out. Maybe somebody can call him, and then I call him, I put him on loudspeaker, and then I put my phone on my laptop so that everybody can hear David.
I think David is lost.
Okay, this will be back. Okay, David, you can go on. Benson, are you there?
I'm there. Let me call David and see whether. Tell David to disconnect completely. We do it on phone.
Okay. Kindly David disconnect so that someone can call you and put you on a loudspeaker.
Hello.
Hi, David.
Yeah, I'm fine.
I want the people to tell us if they can hear you now from the phone.
Yes.
Go ahead, David.
Yes, we can hear. Thank you.
I am David Njoroge. And I'm diabetic type 1. I was talking about the complications I had. I had loss of weight. I used to take a lot of water, and also I was eating too much, but I was continuing losing weight. So when I was taken to Kenyatta, they taught me how to manage my sugars. They told me how to the storage of insulin, and I was able to cope with it. In school, our deputy head teacher connected me to the department called DMI, Diabetes Management and Information Center. That is the place where youth and also small children go to get their medication and also their checkup. They taught me on the way of controlling my blood sugars. Also, we went to seminars which were taught on how to manage our sugars, our diet, and also our exercise. Right now, I'm continuing well. I thank God.
Great. Thank you, David. Maybe the team can go ahead.
Thank you so much, David.
Thank you. Welcome.
You are a strong man, David. I can see your face. You must be very strong. And that is the spirit, huh?
Yes.
Great. Okay.
I always go to the gym. I work out. And also do stretching.
Uh-huh.
Yes.
Okay. So just make sure you are carrying some sweets with you whenever you are walking around, So that I know you have been taught the science of low sugar.
Yeah.
So that whenever you experience them, you can be able to get them and eat those sweets. Also, I'll encourage you to have a band. I don't know if you have it written that I'm a diabetic, so that in case of any emergency, people can know how to help you out. Okay.
Yes, I will make one. I also give back to the community. I have a foundation, which is on Facebook. I always go to maybe to the home. I go to the community to take their blood sugar. So that's how I give back to the community.
Wow, that's awesome. And I would be interested to know where you are based in.
Pardon?
Where do you stay?
I stay at Uberu, Dubai.
Oh, that's Nairobi area. Okay, Odero. All right. Good. You're strong and you're doing a great job. You are not haujihurumi. You have to work and follow what the doctor is saying, and of course, live your life. And that is the spirit. I'm so happy to see you and to know that you are going strong despite the challenges.
Yeah.
Okay, so great. All right.
Endelea hivyo.
Thank you very much.
So maybe the meeting back to Gift, Ngina.
Any question?
Okay. Thank you, Benson, for making work easier for us. Okay, I want to thank the all speakers, Caren, David, and Benson. The session was good. We have learned a lot. And we thank you for humbling your time to teach us about the obesity and diabetes. So we learned up this session. For those who participated on today's meeting, we thank you so much for volunteering your time. We're going to end the session. It's 8, so the session has ended in a good time. So thank you all and have a lovely night. Anyone wants something to say?
Yes, Gift.
You can wind up if you have something to say.
Yeah, I wanted to say that we have other sessions from tomorrow until Sunday. So tomorrow we'll be having a talk about cancer at the same time.
Okay, thank you, Katile. I think we are done with the session for today. For more updates, we'll be updated in the group for tomorrow's session. We can now all leave. Thank you so much. Have a blessed night.
Thank you.
Thank you too.
Hi, David.